It usually doesn't begin with pain. It begins with something people dismiss: a small red spot on the skin, an itch, a bump that looks like a mosquito bite. No fever yet, no nausea, no reason to worry. Most people don't even remember when it appeared. They scratch it, they ignore it, they go on with their day. And that's the problem. Because some of the most dangerous infections don't announce themselves with drama. They begin quietly. They blend into normal life. This is the story of how a harmless-looking mark on the skin can become the starting point of a medical emergency. And why the body often fails long before anyone realizes what's happening. The first hours, in the early stages, the skin doesn't look threatening. There may be mild redness, a little warmth, maybe swelling no larger than a coin. Underneath the surface, however, something else is happening. Bacteria don't need large wounds. They don't need deep cuts. They need access. A microscopic break in the skin is enough. Once inside, the body responds the way it always does at first, by trying to contain the problem locally. Blood vessels widen, immune cells move in, fluid leaks into the tissue. This is why the area becomes red and swollen. At this stage, the infection is still localized. Treatment is usually simple. The body still has control, but this window doesn't always last long. Why the body sometimes loses control. The immune system is built for balance. It must react fast enough to stop infection, but not so aggressively that it harms the body itself. Sometimes that balance fails. Certain bacteria multiply faster than immune cells can contain them. Some release toxins that damage tissue directly. Others interfere with the body's signaling systems. When that happens, the infection doesn't stay confined to the skin. It begins to move, not always by spreading visibly, but by entering the bloodstream. Once bacteria or their toxins reach circulation, the problem is no longer local. It becomes systemic. The shift. Most people miss this is the point where symptoms often become confusing. The skin may not look dramatically worse yet. Pain can be inconsistent or strangely mild. But elsewhere in the body, subtle changes are starting. Heart rate increases, blood vessels begin to relax too much, blood pressure starts to drift downward. The body is attempting to maintain circulation. To do that, it releases inflammatory chemicals designed to fight infection. Those chemicals don't stay targeted. They affect the entire system. This is not the infection itself causing the danger. It's the body's response to it. When inflammation turns against you, inflammation is meant to protect. But when it becomes widespread, it starts to damage healthy tissue. Blood vessels become leaky. Fluid escapes into surrounding tissues. Less blood returns to the heart. Organs receive less oxygen. The brain responds with fatigue and confusion. The kidneys slow their filtration. The skin may feel cool despite internal stress. This is the beginning of a cascade. Once it starts, it accelerates. Why pain can disappear. One of the most dangerous signs is not severe pain. It's the sudden absence of it. As circulation becomes impaired, nerves receive less oxygen. Signals weaken. People may say the area doesn't hurt as much anymore. This is often mistaken for improvement. It isn't. It's a warning that tissue is no longer being properly supplied. In medicine, relief without recovery is a red flag. The moment doctors worry, when patients arrive at the hospital at this stage, the findings can be deceptive. The skin still looks manageable. Vitals may be borderline, not catastrophic. Initial blood tests may not yet show dramatic abnormalities, but experienced clinicians look for patterns. A heart rate that doesn't match the fever, blood pressure that drops when standing, subtle changes in breathing. They know what these signs can mean, because once the body enters this phase, deterioration can happen quickly, sometimes within hours. How a local problem becomes a systemic crisis. As blood pressure falls, organs begin to fail one by one. The kidneys stop clearing waste efficiently. The lungs struggle to exchange oxygen. The brain becomes clouded. This isn't because the infection is everywhere. It's because the circulatory system is no longer delivering what organs need to survive. This is how a small skin infection can trigger a life-threatening condition without ever looking dramatic on the surface. Why early treatment changes everything. When caught early, outcomes are usually good. Antibiotics stop bacterial growth. Fluids restore circulation. The immune response settles. But timing matters more than intensity. Delays allow the inflammatory cascade to strengthen. Once organs begin to fail, treatment becomes supportive rather than corrective. Doctors are no longer fixing the problem, they're trying to buy time. That repeats cases like this follow a familiar path. A minor skin change. Dismissal. Subtle systemic symptoms. Sudden decline. Not because people are careless, but because the early signs don't feel urgent. The body doesn't always signal danger with pain. Sometimes it whispers. This isn't a story about fear, it's a story about awareness. Serious illness doesn't always look serious at the start. Small symptoms can reflect large internal changes. And timing is often the most important factor in survival. This channel exists to explain what short clips can't, to slow down the story, to show how these processes actually unfold. Because understanding how the body fails is often the key to preventing it. In future episodes, we'll look deeper into how infections overwhelm the body, how doctors recognize danger before collapse, and why some patients recover while others don't. This was the beginning. The next episode explores what happens when the body's defense system itself becomes the threat.